Okay, ladies and gentlemen, on behalf of the CEO of UL Hospitals Group and the President of the University of Limerick, I would like to welcome you here today for the opening of the UL Hospitals Intermediate Care Facility here in the UL Arena. My name is Paul Burke. I'm the Chief Academic Officer between the Hospital Group and UL, and I'm also the Executive Lead for this project, ably assisted by the Project Manager, Ms. Breda Duggan. The development of the Intermediate Care Facility arose out of an initiative by the University President, Dr. Des Fitzgerald, at the beginning of last March, when he discussed with the hospital group if we would wish to consider using the arena as a possible field hospital in the event that the hospital system would become overrun with demand, similar to what we were witnessing in Italy and Spain, and based on the apparent success of the temporary hospital structure that had been put in place in Wuhan. 4 rooms here, I'll just point them out to you here. They are the isolation rooms for people if they came to the facility and it turned out that they had an infection and we were worried about them, we wanted to separate them from other patients. Or indeed if someone came here and they became unwell and maybe they were elderly or whatever, and we felt that it was not appropriate to send them back to the main hospital, and we would bring them in and bring their family in there as well if needs be.
How many beds do you say are in this facility?
There are a total of 68 fully equipped, and we have capacity for another 16 to be equipped to bring it up to 84 beds.
And you said 25 patients will be coming in this week?
We hope so, yeah.
And what sort of cases are they?
These will be patients who are recovered from their medical illness, who are considered fit for discharge, but before going home would benefit from rehabilitation, or maybe they are medically fit for discharge, but their social circumstances prevents them going home, or they are deemed to be suitable to go to a nursing home, and then their whole financial package, etc., with fair deal, etc., is taking some time to sort out, and so they would be brought here as well in that situation.
Who will be staffing this facility?
The staff will be experienced staff, nursing staff and medical staff from the hospital, and they'll be supported by allied health professionals from the hospital, who in turn are being supported by some teaching staff from UL along with their students, and then also we have healthcare assistants coming who are being employed here, and a lot of the people who volunteered for that through the call for Ireland, etc., are medical students and nursing students who are interested in coming to work here. Flow into the system is down at the end there. The ambulance will be coming this way, and the patients will be brought initially into that clinical room 1, where all their work will be checked, and then they will be they'll be processed and brought to their bed. The nursing stations here, as you see them, they are facilitated so that the patients, you can look at 2 groups of patients. You can see each of these is 8, and there's a similar nursing station at the other side. So clearly, standing here, you can easily see the first 4 patients on each side. So this group here can easily look at 8 patients. Similarly, down the other end, they can look at the other 8, and we have both sides. We also put in this additional partition, so when you're sitting in your chair behind that partition, you have relative privacy, and we have some additional screens then, mobile screens, when needed. The computer system here is linked to the main hospital system, and obviously we have printers and things for paper, all the paperwork that comes with the patients. Their own hospital notes, etc., come with them from the main hospital. Down here along the side, you have the pharmacy room, and then you have the clean linen rooms and the dirty linen rooms. And then the catering, there's a canteen, all the catering then is brought in through this door here. The meals are ready made, hot and brought in, and then they're distributed from here to the wards.
Professor, great news over Limerick, 4 days, no new cases.
Yes. We're very pleased at that, and we're keeping our fingers crossed going forward. But as the Minister for Health said yesterday, that of the recent cases, there was an average of 4 or 5 close contacts with relation to them, whereas 2 weeks ago it was down to 2 or 3. So we are just a little bit worried about people's behaviour. Yeah. That we really have to continue to focus on social distancing and the wearing of masks.